Welcome, everybody, to our new Define Yourself program interview. I'm very excited to have our guest here. But just for those of you maybe joining us for the first time, this particular program aims to invite unique individuals that have the ability to tap into their potential and or inspire others to tap into to their potential. And so I am very thrilled about our next guest because she's got quite a story to tell. So let me introduce you. Welcome, Kim McKenna Johnson, to our program. Kim McKenna started One Cross Medical Clinic as a dream to help love on people with higher disparities than offer them health, hope, and healing through quality healthcare of the mind, body, and spirit. She's grown her practice from a small facility with her, a nurse, and a daughter as the only employees to now over 40 employees. One Cross serves over 20,000 patients in the area in Kentucky, providing quality health care, counseling, addiction recovery, hepatitis C treatment, and HIV treatment, just to name a few. Any of Kim's patients will tell you how special she is and how one of her favorite things is that she prays with them at visits and brings every morning a group meeting filled with prayer, worship, Bible study, and leadership training for all employees. Kim is an overall extraordinary woman who uses her kind heart, skills, vision, and leadership to serve our community in places where they need it the most. She's an innovator, visionary, and influencer who believes in bringing vision, education, and world-renowned training to her local area. She has hosted Live to Lead events for multiple years, and this past year expanded to offer a workshop in Lebanon. She was also able to bring leadership education and entrepreneurial skills, motivational training, and teachings by John Maxwell to the area. She works diligently to connect local businesses, creating contacts and relationships to better enhance service to our area. And she's the recipient of, and I want to get this right, the Chamber of Commerce. Help me remember what you won, because that was very exciting.
Yeah, Woman Business of the Year award.
Woman Business of the Year. And she happens to be in my mastermind, so I know Kim well, so thank you for being here. And I know how much you've been volunteering in all these various organizations, so your acknowledgement by the Chamber of Commerce is well deserved from my perspective. So welcome to the program. I'm so excited you're here. I was thinking a good place to start would be to maybe at the beginning, kind of why you started, what was kind of behind the One Cross Clinic in your neighborhood.
Oh, awesome. Well, first of all, I want to thank you, Ellen. I appreciate you, and thank you for having me on the show very much. Really just seeing a huge need in our community, and just that need not being served. So the need being people that were low income, working population folks that just didn't have health insurance or were very underinsured, not getting good care. Even people that did have some of the state health insurance, just getting very poor care. And so just not getting comprehensive care or just ER care. There was no place in our community at the time that took care of folks that were in that low socioeconomic group. And so initially I was just looking to volunteer someplace. Didn't plan on doing this and opening a clinic. And there was no place around our area for many counties to volunteer. So I then initially looked at, well, maybe I could just open a part-time clinic in collaboration with the church and have volunteer folks and, try to work to help fill that gap in the community. And worked with my church for about 3 years. And after 3 years of a board and back and forth and people, it just didn't work. So laid that down. Some of the people that I took care of in the clinic, some of them were also people of faith. One in particular, pastor, just came to me after I had laid, that vision down and asked me to pray about opening the clinic myself. And I thought, oh, pastor, I worked on that, tried that, and Um, but he asked me to pray about it, and I did. So 6 months later, we opened One Cross Health. So on a need and on a prayer, honestly, because I had no clue what I was doing. We opened One Cross in January of 2015. That's starts the story.
Now, tell me where you're located.
Um, so our original clinic is in Campbellsville, Kentucky, and this last
Hmm.
April we opened a second clinic in Lebanon, Kentucky, about 30 miles from where the original location is.
And how you're in a pretty, I don't know if rural is the right way to describe it, but like where's the biggest city? Kind of give people a little bit of context.
We're about 2 hours from everything. So 2 hours from Lexington, which is a big city in Kentucky, Louisville, a big city in Kentucky. We're about 2 hours from that location as well. Bowling Green is another, and we're 2 hours from there. So we're kind of 2 hours from anything big. So to go to the mall, you have to drive a pretty good distance.
Got to really love that sale.
Mhm, mhm.
Wonderful. So, since we're friends, we've gotten to know each other pretty well over the last year. Some of what I've been hearing is really the tough road that, leading in difficult times. Maybe you can touch a little bit upon kind of what was the context, the situation, and the learnings from that.
Mm. Well, I think there's been lots of difficult times. Certainly, uh, learning this pathway and learning our way along has been difficult along the way. You definitely have to have a passion for what you're doing to stick with it. And of course, for everyone, COVID was a particularly big challenge. So, big challenge for us on many fronts financially, big challenge for our patients and retaining access to care or keeping access to care. And then the other challenges that came along with that, a lot of the fear and uncertainty that came along with that. So I think the main things that I learned through that is really um, facing your fear. There was a lot of fear going around at that time, and I'm a person of faith, so I brought that fear that I had to my Lord, and just really asked Him for wisdom and guidance on what to do through that situation. And apologize for that. And I think that the big thing is helping. And initially, I just had to help my staff deal with their fear first, because there was a lot of fear there, and they were having to deal with patients that were afraid, and there was a lot of anger and things like that were coming in with calls that really shocked the staff. So really helping the staff work through that fear and those fears. And when you deal with your fears, then you can think about things in a good way. So if you're making decisions about things on fear, then you're not going to make good decisions. So through that, I feel like we made some really good decisions through that. We chose to see our patients and not just have them call with their results. We brought our patients in. We didn't just swab them outside in the parking lot, and if they were positive or negative, send them on their way. They usually came with some symptoms, so we brought them in and we treated our patients aggressively. There were some good algorithms out there for treating patients, some very evidence-based guidelines, and we chose to go and aggressively treat all of our patients. And we saw some really great outcomes from that. So we had very, very good outcomes with our COVID patients. And what brought more on was more and more patients coming in from other communities, even from other states, because it was such a scary time. And what shocked me, I think, most was many medical providers who cared for their patients for years weren't caring for their patients at all during that time, or if they got COVID. So we did then, we still do now, take care of our patients, and we will aggressively do that. So, but I think what initially, we did I had to do personally is really look at what were my belief systems, what were my core values, what did I believe, and then prioritize them in that situation. And so, our core value, one of our core values is to serve our patients. And so by not serving them and not seeing them during that time of need would be definitely against our core values. Another one of our core values is to do things with excellence. And there were lots of good guidelines out there for serving our patients. So we, you know, treated our patients with excellence, with the best evidence-based guidelines that we could find at the time. And then, another one of our core values is to be true to the mission that God gave us. And we were here to take care of people, mind, body, and spirit, and to take care of them excellently and do that with joy and do that effectively. So we communicated that out to the community that we're here for you. We're going to take care of you, help calm their fears to know that we were going to take care of them with excellence, and that we would do it aggressively. And so we saved many lives through that pandemic and brought a lot of those lessons along with us and everything we do.
Wow. Well, I know that I'm going to go off topic here, but it's sort of related. So I know that you said you started off with one clinic and now you have two. And so, you started off with you and your daughter, I believe, right? And now you've got 40 people. So can you maybe paint a little bit about that picture? Because along with that growth journey and leadership comes a lot of, I'm sure, stories and, bumps in the road and that sort of thing.
Absolutely. Absolutely. Yeah. It's definitely been a lot of lessons of hard knocks and pursuing. So when we opened our clinic, many communities will be designated as medically underserved. And politically, our county was designated medically underserved only in the cornfield areas. So the little town that we have, it's small, but the hospital really had a lot of political pull to keep the community from being completely medically underserved, which did not allow providers to come in to really be paid enough to take care of folks that were in need. So that was really hard to take care of folks. Had a lot of times my CPA telling me, Kim, you got to stop taking as many, Medicaid patients or as many free patients. We saw several for free that just didn't have the funds to take care of them because you're not going to survive. And I just couldn't look in people's faces and say no. When you agree to take care of them and they come to you with tears in their eyes, you mean you'll see me, you'll take care of me because there's nobody else. I struggled with that, but God honors that, I think. There was a lot of hard work and a lot of persistence. Some days I was seeing 60 to 70 patients a day and working a lot of late, long hours just to see all of them. Two things, that's what it took to keep the lights on. And also the need was so great here. So, just jumping in and along the way at each crisis point, God met us and brought us through and taught us something new. So I think that's just sticking with those values and that belief system. And I think when you have that belief system, you're going to weather through those trials and tribulations a little bit more because it's not just a job. It's a passion, and you're doing it with a purpose, and the purpose isn't about you. And so when you do that and you're all in because you believe in the cause and the purpose of serving people, then God brings along the skills along beside you.
Mm-hmm. Do you want to mention, and you don't have to mention names, but just some of your journey of getting mentors? And I mean, this is a huge scaling of your business from my perspective. And so, there was those types of lessons and those types of, appreciate you being the sponge, because I know you, And I know you're maybe not giving yourself enough credit here, so I want to give you the platform to share a little bit about some of what resonated with your mentors, because I know you've had a lot that have really poured into you.
Mhm. Yeah, that's something I had to learn too. I wasn't great at asking for help. God sure fixed that. Um, that was not my core belief at all. My core belief growing up was, if you fell on your face, you worked harder to get yourself up. And when you do something like this, and an endeavor like this, and you fall on your face, you need others, and you have to ask others for help. And that was extremely difficult for me at first. And I wasn't good at it. But now I know, and that's a big teaching John Maxwell teaches us. I remember him telling a story about a man who came to him, said, "And look, I'm a self-made man, and look what I've done." And John said he wasn't impressed at all, and told him if he would have brought a team of people with him, he would have been much greater. And you know, that's the key, is bringing others with you, finding other leaders, training other leaders here in our community. It's been real integral to us, or important to me, to help train and bring those leadership skills here to our small community, because they don't see a whole lot of strong leaders here. They're not taught a lot of leadership skills. So that's why bringing Live to Lead, and I do a lot of Maxwell teaching with my staff, um, and bring those principles to help teach them. So it's important.
How, uh, what's like the population generally for your town?
What's the population size?
Yeah, I'm just trying to get a sense for. I grew up in the big city, sort of. I grew up in California, so the San Fernando Valley had millions of people. So I'm sure I don't relate to your situation.
So our population here in this county is 11,000.
Mm-hmm.
And so, it's a small town, but it's a pretty good small town. We have a university here, and it started out as a little college, but now it's a university. So it used to be very rural, as far, and farm community. Unfortunately, a lot of the farm industry has left. So there used to be a lot of textiles here, fruit of the loom, a lot of the a lot of sewing factories here at one time. All of those are gone overseas. A lot of the dairies have shut down, because they just can't be profitable enough in the small town. So it's really kind of sad to see that, the community.
Economic pressures.
Yeah, and the suffering of the
Yeah.
people because of that, because these are not lazy people, and their prospects for employment is a lot lower. There's not a whole lot of ways for them to do well and make money and to thrive here. So there used to be a big tobacco industry here, and that's been all shut down. So there's been a lot of industry that was here and came here and then is shut down. So it's really devastated the community, and so that brings coping mechanisms like drugs, and
Mm.
a lot of other social issues with unemployment. So
Mm-hmm. So I know that, kind of on the personal side, that, and you'll help me make sure I got this right, but you started, the first one in 2015, but you were raising lots of kids. You'll have to tell me how many. I forgot. And you and your husband have a farm. So, like, didn't you already have your hands full? Tell me a little bit more about that.
yeah, so I have 5 children. I have 8 grandchildren, with one more on the way. And have a little boy on the way, a little grandson on the way.
Yay.
The farm is a peaceful place. So sometimes people can be, hard. Not hard in the sense that, oh, I don't want to take care of them. I feel like it's a very huge honor to take care of them. But, people's lives are hard right now, and they're complicated. And there's a lot of brokenness in homes these days. And when you bring that home, you need a little bit of a relief, because if you do care about people, you're going to you're going to carry some of that burden. So taking care of sheep and goats and chickens is a beautiful way. If it's a real bad day, I'll call my husband, don't feed the sheep, I want to come and feed them and be amongst them for a while, and be amongst
Mhm.
that peace for a little while. So
How
um,
many sheep do you have? I'm just curious.
oh, it's lambing season now. So far, we just got two baby lambs and one little goat. So
Oh,
we
cute.
should probably drop about 30 little lambs. So I think we have 40 ewes, which girls,
Wow.
and so hopefully they will all lamb, and maybe a lot of them have twins. So who knows?
So a little embarrassing story with me at the center of the embarrassment. I was in Ireland a few years ago and we went to a working farm with the, sheepdogs. I can't remember what the breed was, but they were amazing. But it was a little bit like a show. And so I came up there and they're like, we need a volunteer to give the, instructions. So they tell me what to tell the dog, and what does the dog do? Peas on command.
Oh,
Of course, everybody laughs at me because I thought they're going to go do all that crazy stuff to get the sheep to go in the right direction.
yes, yes.
So it's pretty crazy, but that's really great. So with kind of the view of the show to think about tapping into either your potential or potential in others, is there anything you can think of? I mean, that would be a good like little story vignette. I mean, obviously I see huge, you stepping into a lot of area of potential for you just because we're friends and we've been in a mastermind for over a year. Do you want to maybe, does any stories come to mind? Can you think of like maybe anyone on your staff or people that you know that have just kind of risen to the occasion, that maybe they didn't have that belief in themselves in the beginning, but somehow they, through community or you know, other
Well,
means.
I tell you, we work on belief constantly, with empowerment, mentoring, community, and being part of that. And I'm so grateful to be part of that and really work with mindset. And they've helped me with mine, because my mindset was much different in the beginning. And when I joined John Maxwell and joined all that, my clinic size was probably 5 or 6 employees at the time. So I really attribute a lot of its growth to that and our mindset training. But I brought that to my patients, and I'll tell you about one of them. I had a patient who struggled with addiction quite a bit, and he was in and out of the hospital a lot. A lot of times we had to put him in the psych unit for a month or two at a time because of suicide and things like that. And we walked with him through a lot of crisis situations in his life, some of those being the suicide of one of his children and the drug overdose of one of his children. So, and he, was the one who introduced his children to drugs. So that you can imagine the devastation and heartbreak uh, that we've been with this fella, and he was in and out of drug rehab centers multiple times without it working, without it helping him. So we initiated a office-based addiction and drug treatment program here in the clinic, really out of need. It was not something I originally intended to, but we had known this fella as a family practice patient and dealt with a lot of his mental health issues prior to us initiating this program. But when we initiated the program, we initiated it with a group of people. It wasn't just the provider and myself, it was a team. It was a nurse that had a recovery background, it was peer support that knew what they were talking about. We had initiated mental health in our practice as well. So we have a psychiatric nurse practitioner, which wasn't there then, but we did have counseling. So what we did was just come around this fella and support him as an entire family. And I remember talking to him in one of the visits, asking him what he wanted, what he, get to, what was his vision for himself, what is something that he wanted to see himself do. And it took 3 whole visits for me to get out of him, well, I would like to have the same place to sleep every night, because he was essentially homeless. He would go from couch to couch to couch, and he didn't know whoever was going to let him lay on the couch there that night or whatever. He would go. So he didn't have a house, and so it was like, yes, finally I got something out of him, and but it was a start for him. And then we started talking about what's one thing we can do. So, and really worked with him and supported him in his fears and anxieties, because he thought that he was too messed up to work. That he had too much anxiety to work. That his mind was too, messed up, and so he didn't like people. He was afraid of people. He had isolated himself for so long, but uh, that guy is now gainfully employed. He's been gainfully employed for a couple of years now. The pastor or the chaplain in our clinic uh, married him, and not only is he working, but he's supervising a huge team of men. And he's very financially stable, and he's doing really well. So he did so well coming through the program and that support. And it started, his improvement started when we started asking him, what is it that you dreamed? He never thought about it. He never thought to think about anything in the future, or to think about what he wanted really in his life. And so um, that was challenge. Of course, it took a team, and it took a lot of work with them, and it took a lot of love. But we see miracles like that in our program. And he had a girlfriend from the past. He was doing so well. He went and drove to Louisville, found her underneath the viaduct eating out of trash cans, and brought her home. And we put her through the program. And again, they're married, and they're doing very, very well now. But those are some of the changes when you take care of that whole person, and you really care about them. They're not just a number. They're not. You're going to walk through them, the process, good, bad, and ugly, and all the things that go with it. And
I was just at a conference and I learned a really cool phrase. I am proud with you.
mm, that's
Isn't
good.
that cool? It
Mm,
just seems super appropriate to what you're describing. Um, when I was envisioning my business, and the Seidel method, I have a motto. It's don't find yourself, define yourself, and go beyond. And when you're telling that story, you tapped into his wants. Like,
mm,
I don't know if finding a roof over your head is quite defining yourself, but it was sort of the start of what were
speaking.
his needs, what does he want in his life, and to such an extent that now he was helping his girlfriend. I mean, wow, it brings tears to my eyes. It's so inspiring. So
Yeah, yeah.
thank you
But
for
it's
the work you do.
yeah, it's sad when you look at somebody and nobody told them they were worthy. Nobody
Yeah.
told them that they were worth something. Nobody told them they could be anything more than uh, what they were. And so,
Yeah. Well, that to me is like the definition of a mentor, is that someone who can look at someone and see the potential in the other person and kind of shine that potential almost like a mirror. And so if I'm the recipient and I'm looking at the mentor, I can borrow their belief. I can see their excitement and their 100% certainty about my own potential, even if I don't see it yet, and somehow tap into that. And it sounds like your program, even though it wasn't quite a mentoring program, had many of those elements.
mhm, yeah, absolutely.
Wow. Well, I don't know if we talked about this one. Let's maybe wrap up. We'll have another question after this one. But did we talk about like the difficult times that changed your business? I mean, I know that we talked about like COVID and that, but now that you're scaling, it seems like maybe bureaucracy. I don't know if I want to call that a challenge, but regulations. Anyway, I don't know if you want to go there, but what comes to mind, in terms of how you scale your business? Because you're now, I don't know if it's open. I think your second location's open already. So.
Hmm, hmm. Yes. I think the biggest change is how we interview leaders. So people who are going to be leaders, so people like medical providers that come, they're going to be automatic leaders because of the position they have here. And so, honestly, if they smiled well, were smart, seemed smart, and liked people, they were hired. And that was prior to COVID. And, we had a lot of upheaval then, and a lot of people who didn't agree with um, taking care of people. And so we interview people pretty strong if it looks this way, or if this is what we're going to do, we're going to continue to see our patients, we're going to look for and do aggressively, even if it's not popular, to take care of our patients to the best of our ability. And we may do unpopular things. Are you okay with that? And so one of the things that for the first time ever. So think about the medications that are written every day in the United States. About 40 to 50% of them are written off label. And I don't think people realize how many drugs we write every day for people and they're written off label. What does off label mean? Off label means it doesn't necessarily have a designation for that illness. We know it works really great for this illness. The one you're suffering from is very similar, and it makes sense that it will work for that one. It costs so much money for a product to have a new indication. They have to apply for it. It costs millions of dollars to have it approved. So a lot of companies, they get their initial designations of and approvals, and we know that it'll work for other conditions. So that's why there's so many off labels. But in the first time in America, they were pressuring medical providers not to write a particular medication off label for people that were struggling with COVID infection. And it didn't make sense to me. Well, we write off label drugs all the time. Why are you trying to prosecute, limit, threaten
Or get
providers?
in the middle between the provider and the doctor. Yeah.
Sure. I really didn't realize medicine was that political. I should have known. Uh, I talked to a friend from the CDC and I said, oh, I didn't realize it was this political. And he said, well, I saw this coming a long time ago. And I said, well, my head must have been under a rock or something, because, and I guess it is in some aspects, but we never saw their getting in the middle of the doctor patient relationship like we did with COVID. And so now we know, oh, this does work, it did work, that but we knew that from prior studies. So there were prior studies that SARS-CoV-2, it was the second COVID that came through. There was a COVID-1 that was prior to that was actually a lot more deadly than COVID-2. It was a lot more self-limiting. It wasn't as contagious, but we found in those studies that hydroxychloroquine and ivermectin worked very well in those situations. We already had studies to show and to prove that with a similar virus, it worked well. So it wasn't like we were just pulling information out. And so, but there was a lot of pressure, and we lost providers during that. We lost 3 providers during that time period. So I ask those questions now. If it's not popular, are you still going to do what's best for the patients here? Because that's what we do here, and I need to know if you're on board with that. So I think that's the biggest thing, really. Most people undergo a 2-hour interview if they're going to be a leader here. So it's a lot, but we're very picky about who we let in.
Well, it reminds me that second part of my motto, the define yourself, is really not so much about, it's more like the character. Like, and I know Dr. Maxwell talks about character building, but like what part of you in your kind of soul of souls, how do you describe your character, and I just listening to you, it just makes you reflect on that, because when the going gets tough, the tough have to get going, and they have to like stick to their scruples and their principles. So
I think a huge part of my character is grounded in my faith, and
yeah.
So that's where I'll seek wisdom before anything. When the world doesn't make sense, that's where I'll go seek wisdom. And I'm
Right.
thankful for that, because God reminded me of what fear does to you when you're dealing with fear. Fear decreases your immune system. It does a lot of things that we don't, and it also affects decision making. So, really working with myself and my staff in combating that, so we weren't making decisions based out
Right.
of fear. And I think courage is the big one. Courage and tenacity. I'm too bullheaded to quit. So when everybody
Yeah.
else would have quit, I'm too bullheaded to quit. So
Well, just so you know, Kim, I think your character is impeccable. The point, and maybe I didn't make this clear, but as you were going through the interview process, you were trying to determine the character of the providers to
uh,
see how they were going to handle the pressure. Because
yeah,
it's one thing to imagine it theoretically, and another, I mean, even in an interview, you're getting the best, approximation of it. But yeah, yeah. So that's amazing.
I think, and then I talk to my staff in. Uh, are you all in? Are you a servant and have a servant heart? We want to have a servant heart in serving each other and our patients, but there's a difference between a servant and a son. A son is going to follow their leader. Um, a son is going to stick with them in hard times and in among the pressure. And um, so there's a difference. Are you going to take ownership? Because a son takes ownership. A servant will flee when it gets difficult or when it's hard. And so I'm looking for people who are more acting like sons and not servants. And
Mm-hmm.
that's what I'm asking for them when they interview. Are you willing to study outside of your original continuing education? Are you willing to go above and beyond for your patients? And most aren't, to be honest, most aren't. So again, I'll probably interview 10 providers before I hire one.
Yeah, my first husband's dad was a dermatologist. He went to the Mayo Clinic and he established the Dermatological Society. And so when I met, his son, he had been in, medical field for years and years and years. And he told this one story. I feel compelled to tell it now because it's a little bit like, the going above and beyond. Well, when he was in his residency program, he decided he really wanted to learn how to take blood, even though all the nurses had to do that. As a doctor, you didn't have to do that. But he was like very diligent and he wasn't very good in the beginning and he got better and better and better. Well, then this one patient came in and it was really crazy busy at the hospital and the guy was in a fire and it was like he was the only one there and either he was going to be able to get, you know, you know this better than me because I don't know all the medical stuff, but they had to give him like liquid, something.
Big
And so
time.
they had to get the line in. And it was like, if they didn't do this in the next, 5 minutes or something, the guy wasn't going to make it. And Jim's dad was able to do it. And it was like, it's just that, and he had a different philosophy too. Besides that, he had the, I'm going to listen to my, my patients, and then I'm gonna, in some cases, just get out of the way because they're gonna solve themselves. I mean, not that he wasn't educated; he was very educated.
Right.
Um, and so, yeah, it
Yeah.
was just really, really cool. Like he could see, speaking of off label, he could in his own practice could see how, oh well, if you do that, and I can't remember what it was, that's going to solve that challenge, and it wasn't what the medicine was originally diagnosed for. And so all of us, I mean, for the longest time, I was always shopping for doctors that were very innovative from a clinical side because I know that they can't teach you everything in school.
Right.
You have to observe and participate in life and come up with your own, perspective.
Yes. Very much. Yes.
Wow. So, one just parting thought or question, and I didn't give you any time to think about this one, but when you think about, because in my view, it's like just you are pouring so much into this amazing, your family and the farm and 5 kids and 8 plus 1 grandchild, and everything with One Cross. What fills your cup? When you look at it all, like the tapestry of all of it.
Spending time with Jesus, that fills my cup. And if I neglect that, I start fading. And so
Mhm.
spending time alone, and I'm not just talking about just going to church on Sunday, just getting alone and being in that quiet space. And so
Mhm.
and sometimes I'll just have to get out of town to do that aloneness because there's too many distractions. But when I start feeling overwhelmed, then I need to spend 4 or 5 days alone with God.
Mhm.
So, I do that regularly at home. Um, and I have a special space that I do that with at home. But um, sometimes you need more.
Yeah. Well, thank you so much for your time. This has been very amazing. I'm going to do my little exit video, but before I do that, how do people find you? It's called One Cross Clinic.
OneCrossHealth.com.
Oh, onecrosshealth.com.
Yep,
Awesome.
that's
And
us.
look up Kim if you're ever in the Kentucky area. I just actually introduced her to a friend of mine who's moving in the area. So thank you so much, Kim. And,
Thanks, Ellen. You have a blessed day, sweetheart.
and you too.
Thanks.
Thank you, everybody.